Just a little bit of housekeeping. Thank you. Welcome, everyone. We have a larger room, but as all of our committees on the Senate side, they go for 1 hour, actually 55 minutes, because we have to vacate the room at 8:25, so 9:25, so that the next committee has time to come in and set up. We also want to allow plenty of time for questions from the committee. We do have one of our members will be on WebEx, and we have a replacement for Senator Molly Baumgardner in our Majority Leader Larry Alley today. We do have testimony from proponents and opponents, but I want to explain. Somebody has asked me, or several people have asked me, what's an informational briefing? How's that different than a hearing? A hearing is when a bill comes over from either we have a Senate bill or there is a House bill. When a House bill has been heard on the House side, passes that committee, and then passes that floor, then it comes over and it may be assigned to this committee. And if so, then we would have a hearing. That's different than an informational briefing. This is an informational briefing. We are allowing some opponents to give verbal briefing on their side. However, with the time constraints, we're allowing 15 minutes for what we're considering the proponent side and 15 minutes for the opponent side. So we have 6 opponents that will be speaking, and they will each have 2.5 minutes. On the 15 minutes for the proponent side, they have selected to do 5 minutes for 2 of their presenters and or conferees, and then that would leave 2 minutes approximately for the others. So for the proponents, because that would be 16 minutes, and we want to try to be fair to both sides, I'm asking that if you don't need your full time, that you not take your full time. So we have 2 timers running. One timer is per conferee, the other timer is for the full side. Does that make sense, everyone? Yes, Senator Petty.
Madam Chair, I just want to make a point that I am disappointed that we're using our valuable committee time to have a informational hearing on a bill that has not passed the House, has not even been introduced in the Senate, and we have many more important issues like Medicaid expansion that we could be using our community time for. So I want to voice my opposition to this use of our valuable time.
Noted. We will begin the hearing 27 of House Bill 2791, the informational briefing, and we will start with Chloe Cole on behalf of Do No Harm Action. Is Chloe in the room today? Oh, yeah, Chloe, I'm sorry. I'm going to ask you to hold just a moment because I neglected to have the reviser give us a quick briefing on the bill first. Okay, you can have a seat right there in the front if you like. Jenna, thanks for the reminder.
Good morning, Madam Chair, members of the committee. Happy Leap Day. House Bill 2791 is also being heard in House Health today. So if you don't get enough in this hour, you can come join us at 1:30. House Bill 2791 enacts the Forbidding Abusive Child Transitions Act to prevent healthcare providers from treating a child whose gender identity is inconsistent with the child's sex, authorizes a civil cause of action, restricts the use of state funds, prohibits professional liability insurance from covering damages for healthcare providers that provide these treatments, and authorizes professional discipline against healthcare providers who perform these treatments. Section 1 sets out the name of the bill, sections 1 through 7 as the Forbidding Abusive Child Transitions Act, and defines terms used in the bill. Section 2 would prohibit the use of state funds to pay for, subsidize, or promote social transitioning, medication, or surgery for a child whose perceived sex or gender is inconsistent with such child's sex, and sex is defined in Section 1. Section 3 would require a healthcare provider to obtain informed consent from a parent or guardian of a child before discussions with a child. These discussions would include possibilities of social transitioning, medication, or surgery as a treatment for the child if their perceived gender or perceived sex is inconsistent with the child's sex. Informed consent would require the healthcare provider to provide notice of certain things. These are starting on page 2, lines 29, and this would be risks of social transitioning relating to discordance between the child's perception and such child's sex could increase. Regarding puberty blockers, that such medications have not been approved by the FDA as a treatment for gender dysphoria, that they've been used to chemically castrate sex offenders, have known harms including diminished bone density, infertility, have permanent negative side effects, have not been studied to determine long-term risks to children, have unknown side effects regarding brain development and cognition, and then risks regarding cross-sex hormones, specific ones for males and females with conditions that I'm not going to attempt to pronounce, but are on page 3, lines 12 through 21, and then also risks of surgical procedures. If a healthcare professional fails to provide this informed consent before knowingly discussing with a child these possibilities, the healthcare professional has engaged in unprofessional conduct and would be subject to discipline by their relevant disciplinary board. Section 4, subsections A and B provides that except as provided in subsection C, a healthcare provider shall not knowingly provide surgical, hormonal treatments, puberty blockers to a child whose perceived sex or gender is inconsistent with such child's gender. And it would give the list of those specific procedures and hormonal treatments. And then subsection C says that the treatments prohibited by subsections A and C would not apply to treatments for other purposes, including treatment for individuals born with a medically verifiable disorder of sex development, and it lists those different types, and also treatment of any infection, injury, disease, or disorder that has been caused or exacerbated by the performance of a procedure in subsections A or B. Section 5 sets out the repercussions for a healthcare provider who violates the consent or treatment prohibitions in sections 3 and 4. And the first of those relates to unprofessional conduct, which we have the statutes in sections 8 and 9 that I'll provide a little more explanation there. And subsections B sets out a strict liability tort, and this is a little bit different than your standard tort. To prevail in a strict liability tort, a plaintiff would have to prove that an action occurred, that the action was the proximal and actual, or was the actual and proximate cause of the injury. This is more common in things like product liability or dog bite cases. In strict liability, a defendant can be held liable for committing the action regardless of mental state. A defendant would not have to prove negligence in order to prevail in this tort. So if the medical procedure occurred and then the individual were to face negative repercussions because of that medical procedure in the future, the physician or nurse practitioner would be held strictly liable without having to prove negligence. And this could be pursued in the next 30 years. This is not a tort that was in the bill last year. Subsection C and D set out torts for a child as well as the parents of a child who was provided treatment in violation of sections 3 or 4. And an action against the healthcare provider could be filed within 30 years from the date that the individual turns 18 years of age. And you may remember in last year's Senate Bill 233, the civil cause of action was limited to 3 years. Section 6 would prohibit a professional liability policy issued to a healthcare provider from including coverage for damages assessed against a healthcare provider who provides treatment in violations of sections 3 or 4. This would be in addition to the bill. Section 7 is a standard severability clause, which is an expression of the legislature's intent, asking a court who is interpreting it to please not strike down all the provisions of the bill if only one provision of the bill is constitutionally problematic. Section 8 amends KSA 65-1120, relates to professional discipline of Board of Nursing licensees, and it would add violation of the act to the list of grounds for disciplinary action. The same thing in Section 9 amends KSA 65-2837. This is professional discipline for Board of Healing Arts licensees. It would add violating the act to the definition of unprofessional conduct. The difference between this bill and last year's, this bill includes Board of Healing Arts licensees, so your nurse practitioners, or not, excuse me, Board of Nursing licensees, which would include nurse practitioners. Section Senate Bill 233 had an automatic loss of licensure provision if a physician were found to have committed the act, and this would allow the due process for the Board of Healing Arts to investigate and give the physician or nurse a chance to be heard before stripping them of their licensure. And last year's bill only applied to physicians. So I think that's a pretty brief, but I will be happy to answer any questions you have.
Committee, we have about 2 minutes for questions for Jenna. Yes, Senator Petty.
Thank you, Jenna. So on page 2 in line 28, it says a state employee whose official duties include the care of children. So that would include anyone who's a state employee that deals with children? So a teacher, counselor, social worker?
The bill does not provide a definition for state employee, but I would, if we look to our standard definition, that would be your employees of the executive, judicial, legislative branch, as well as agencies. So this would likely include like employees of DCF who specifically have interactions with children.
And lastly, do we have any other pieces of legislation where you have 30 years after the piece of legislation that disciplinary action can be brought?
The largest statute of limitations that I have found other than this would relate to what you all changed last year in regards to sexual assault victims who were victims as children. And that was a 13-year statute of limitations after the child turned 18 years of age.
Thank you.
Committee, other questions? Senator Thompson.
Real quick, with regard to setting those policies on statute of limitations, legislature determines that, correct? I mean, if we decide 30 years, there's nothing to prevent us from doing that? Or is it precedent that creates that statute of limitations? Just curious.
There's no legislation or constitutional provision that prohibits a legislature from setting a relevant statute of limitations.
Thank you. Thank you, Madam Chair.
Jenna, thank you so much. And we'll begin with our first proponent, Chloe Cole. Welcome to committee.
Good morning. My name is Chloe Cole, and I'm a 19-year-old detransitioner and a former trans-identified child. Before I was a teenager, I fell victim to gender ideology. This ideology targets kids like me, who are different, who are on the autistic spectrum, who are struggling with puberty, trauma, and forming their identity as they grow into adults. We need to stop the medical industry from taking advantage of these kids the same way that I have been, and that thousands of other children have been. This abuse is standardized in healthcare throughout the country and the rest of the world by the World Professional Association of Transgender Healthcare, or WPATH. I was afraid of growing up into a woman. I had an early, stressful puberty, and I hated the attention that I got from my developing body. I had unresolved sexual trauma from an assault that I felt like I couldn't report because I thought nobody would believe me or take me seriously. And I began to associate my breasts and my femininity with weakness and being taken advantage of. I learned from the internet that all my problems stemmed from the way that I was born. But I could fix myself by changing my body. None of my doctors at any point explored any of these feelings or told me that I was strong enough to get better, that I could grow out of it. My pain and my naive judgment as a child was allowed to dictate the rest of my life. Today, I experience joint, back, and pelvic pains. I have issues with atrophy, with my sexual dysfunction and pain, and the testosterone may have made me infertile. The loss of my sexual development and of my breasts has marked the loss of a major part of my sexuality and my identity as a now adult woman. I never will have the option of feeding my children with what God gave me. The skin grafts that they created out of my areolas have become open wounds, and I have to bandage myself every single day. The damage done to my developing body was all thanks to the negligent standards of care written by WPATH. But there is no acknowledgement of those of us who detransition. I received absolutely no guidance on how to stop transitioning, and now I don't know what the future of my health will look like in a few years or over the next few decades of my life. Only time will tell. I didn't deserve this, and neither does any child in your state or the rest of the country deserve to face this abuse. I was far too young for the adults around me to enable me to make decisions governing my body that would affect the entire course of my physical, psychological, and reproductive development. What children like me need isn't the removal of their body parts or the halting of their natural development or psychological manipulation by adults. They need compassionate, holistic care. As adults, we need to ground children in reality and guide them towards building their identities in a healthy manner. We need to act now because our youth need us more than ever. This is not a matter of left or right. It is a matter of right and wrong. And you know that this is completely wrong, and you need to do something about it. Thank you.
Thank you very much. Next, we will have Pamela Garfield.
Do I get 5 minutes or 2.5?
2.5.
Okay. Hello. My name is Pamela Garfield Yeager. I'm a licensed clinical social worker who graduated from New York University in 1999. I've been licensed in California since 2005. My vast experience ranges from working in schools, hospitals, residential programs, and private practice. I've also spent 10 years of my career as a clinical supervisor. The bulk of all of this experience was with vulnerable children with complex mental health issues, which is exactly who we are talking about protecting today. You might be thinking, what about all these kids that are questioning their gender? What if they kill themselves? That's what they keep saying. And the data keeps saying that. And of course, affirmative care saves lives, right? We keep hearing that. Well, first, we must step back and recognize that anything clinically sound never fits neatly in a slogan. We have never had a one-size-fits-all solution for any clinical issue. Second, let's take a closer look at that data. There are 0 studies that prove that affirming a person with a trans identity prevents suicide. None of control groups to make this claim. The only data we have tells us that the transgender population has higher rates for suicide. And this is true because people who identify as trans do have coinciding mental health issues. And the trans community admits this in their data reporting and their marketing because they even have a special trans flag for trans-identified autistic people. They would say this is for inclusivity. I would say this is recruiting vulnerable kids. The data side, let's talk about this from an ethical standpoint. As a therapist who's worked for years with vulnerable kids with suicidal ideations, I know this is not clinically sound. To tell them that they will kill themselves if they don't get what they want. All this suicide talk is against everything mental health professionals have ever stood for. And it's plain irresponsible. We are setting kids up for a life of emptiness because they're getting the lesson they must blackmail people with suicide threats to receive love. When we reinforce this suicide myth, we are telling children that we don't believe in their ability to handle problems. In addition, we start to believe that they must go through painful surgeries or die. And this is a scary message to put on repeat to children.
Thank you so much.
Thank you.
Next, we have Jamie Reid. Welcome to committee.
Good morning. My name is Jamie Reid. I have a Master's of Science in Clinical Research, and I worked in a pediatric gender center in St. Louis, Missouri. I was a firm believer in pediatric gender medicine. In my 4-year tenure there, I saw many children receive so-called gender-affirming care that ended up leading to significant harms and poor outcomes. I am a passionate advocate for these kids, and so I spoke out as a whistleblower to bring about reforms. We had patients in my tenure detransition. We had patients in my tenure have total radical mastectomies and express regret within months. I counseled patients who had vaginal lacerations due to the atrophy from testosterone, who we had to send directly to the emergency room, who then went directly into emergency surgery. I am a lifelong Democrat, a gay woman, and my spouse is trans. As a Democrat, I adamantly disagree this is a left and right issue, and as a gay woman, I implore Democrats to consider how medicalization of children and adolescents will harm young gay and lesbian people. Medical interventions, now known as gender-affirming care, are no longer considered evidence-based, and it's become increasingly clear that young people are being significantly harmed by these interventions. I know this because I saw it directly. I worked in a pediatric gender center. Last month, the World Health Organization announced that they will not be issuing any guidelines related to transition care for children because there is, quote, limited evidence regarding the long-term outcomes of affirmative care for youth. After I blew the whistle in Missouri, the state legislature passed a bill to stop children and adolescents from being placed on puberty blockers, cross-sex hormones, and surgeries. It was absolutely necessary that the state legislature do this. I worked in a pediatric gender center. They will not reform themselves. I initially hoped that the gender center clinicians or the hospital administrators would do the right thing. They did not, they could not, they will not. This field is completely off the rails. They do not have any mechanisms built in to keep kids safe. I hope that the medical associations would do the right thing. They did not. Children and adolescents right now have no one else to turn to except for state legislatures. Please know that this is a bipartisan support for these regulations. There is support directly from the LGBT, there is support from adult trans people, there is support from lesbian and gay people, and there is support for Democrats to support these kind of regulations. I call upon my fellow Democrats to support me and join me in supporting these bills. It is neither liberal nor progressive to medically transition a child. It is not kind, it is not compassionate, it is not evidence-based, and it is not safe. It is profoundly harmful, and it is time for state legislatures to stop making these things political issues and just do the right thing on behalf of our kids, because no one else is willing to step up and do this except for you. I welcome your questions.
Thank you. Next, we have Britney Jones.
Good morning. My name is Britney Jones. I'm with Kansas Family Voice, and I will keep it very brief and reserve whatever time you guys need for questions or whatever else you'd like to use it for. I work for Kansas Family Voice, and we believe that children deserve to be protected, that they deserve to have a full range of options in pursuing appropriate care when they're dealing with difficult situations. We support HB 2791 because it ensures that Kansas children will be given time to pursue proper therapies to deal with underlying issues. HB 2791 helps kids by holding those accountable who have put their well-being at risk for the sake of their ideology. Kids deserve help and not harm as they grow towards adulthood. So I'd strongly urge that you support this bill. It's passed in 20 other states. Similar bills have passed in 20 other states, and it has been upheld by multiple circuit courts. So thank you, and I sit open for questions at the appropriate time.
Thank you, and I think we've allotted more time then to our last conferee, which is Dr. Ivan Abdou. Excuse me, let me find out. 3 minutes and 40 seconds left of the 15 minutes.
That's pretty specific. Good morning, Madam Chair and committee members and opponents and proponents. I'm Dr. Ivan Abdou. I retired after 42 years of medical practice. I've included credentials in my written testimony. I treated and advocated for transgender individuals for 30 years as medical director of the Omaha Gender Identity Team. We cared for transgender individuals for many Midwest states, including Kansas, because no one else in the area provided that service. It was quite unpopular at that time. So I don't know much about the particulars of the bill, but I stand in support of any bill that would prohibit the transition of children. I'm clearly not what some people would call anti-trans or transphobic. I come before you today simply to offer my 30 years in the business perspective. People on all sides of this issue want what's best for these kids. The disagreement is over what's best for them, medicate and operate or wait until adulthood. I hear debates over what is and isn't true, proven, moral, evidence-based, safe, reversible, irreversible, on and on. I genuinely respect everyone involved on every side of this issue, so I won't engage in any us-them conversations. My priority is patient safety, and I hope we can all agree that safety must always come first. So in the name of safety, we just need to ask and answer 3 questions. What are the current generally accepted standards of care? Answer, there are none. It's popular to refer to WPATH as evidence-based standards of care, but that's actually not correct. How can we determine with certainty the gender trajectory of a child or adolescent in their lifetime? Answer, we can't. No one can. Even WPATH includes at least 11 literature citations to this effect. What are the potential consequences of erroneous medical or surgical treatment? Answer is unjustifiable, irreversible harm with lifelong effects. Even WPATH includes at least 7 literature citations to this effect. And I've submitted information supporting these points. Sometimes medical and surgical treatment goes well, but some of these kids will choose to turn back, and they cannot be ignored. So it is mandatory that policymakers ask and answer this question. What is an acceptable number or percent of children who experience irreversible harm with lifelong effects because of erroneously receiving medical or surgical management? In this case, any answer more than 0 means the decision to proceed with medical or surgical treatment is based on something other than safe medical practices. I submit that the least unsafe management is counseling by a competent therapist. Sometimes caring means saying no, or at least not yet. I'm normally not in favor of government regulation in medicine, but when physicians and parents are willing to risk the kind of potential harm to these kids, someone has to step in.
Thank you so much for your time.
Thank you.
Committee, we have about 5 minutes for questions for the proponents. Senator Thompson.
Thank you, Madam Chair. This is for Jamie Green. Hi, Jamie. Thanks for being here. A question, and I ran into this situation where a grandmother and parents were concerned because their granddaughter was feeling like she needed to transition to prevent suicide. And they were convinced of that because of doctors and psychologists they had talked to. Did you see a lot of this, and what would you say about that situation? Because it seems like they were their objectivity on how to deal with this was being clouded by their emotion and worry over the potential suicidal ideation. How would you address that?
Suicide is something that can be a known social contagion. And the way that this is being discussed in general in this room, across the media, across this entire medical industry is going against every single good known practice about how to decrease social contagions. I saw doctors directly tell patients that it was either medically transition your child or you would have a dead child. That is absolutely not how medicine should be practiced. There are known ways to decrease suicidal ideations in all ages. There's good quality practices that psychology, psychiatry, case management, social work can do to address those feelings of distress in young people. That has nothing to do with giving medical interventions like a puberty blocker or cross-sex hormones or surgery. There's no known relation to giving a blocker, cross-sex hormones, or surgery to decreasing suicidal ideations either.
Okay. Thank you. I obviously, they were very emotional, and they saw that as their only option. So I don't think they were being properly counseled on that.
But we're telling that to young people.
Yeah.
We are directly telling young people that narrative instead of telling young people how to be resilient, how to add things to their own toolbox to deal with distress. We are not teaching young people the ways to mental health. We are increasing mental distress.
Thank you. Thank you, Madam Chair.
Jamie, while you're there, I have a quick question for you, and I know we have others. It was mentioned about autism spectrum. I remember reading an article where they interviewed you, and one of the things that you mentioned was how surprised you were, how many of these patients who came in who had been identified on the autism spectrum. Could you address that real quickly?
Absolutely. We saw statistically higher than average rates of ASDs, autism spectrum disorder, in our patient population. But we also saw higher than statistically average rates of ADHD, bipolar disorder, borderline personality disorder. This is a patient population with significant high psychological comorbidities. And the problem is what's happening is called diagnostic overshadowing. So all of those other mental health conditions are completely pushed aside the minute someone says anything about gender, trans, or gender distress. And so this entire medical industry is no longer putting into place gold standard good practices, which is you address the underlying mental health concerns first and foremost, and we stabilize somebody until they can get to adulthood. And if they want to seek medical transition at that time, we know that we've given them all of the good, positive mental health treatments so that they can do so in an open-minded, best practice manner.
And then very quickly, you had mentioned in the article that you saw girls coming in as a group like they were going in to get their ears pierced.
We saw cohorts where an entire classroom would have 4, 5, 6 trans-identified students. That is a statistical improbability unless you are open to the concept that there is a social contagion ongoing right now in this country around gender.
Thank you. And next is Senator Holscher.
Thank you. My question is for Chloe. Hi, Chloe. I think you were here last year, correct?
I was.
Okay. Can you remind me where you're from?
I'm from California.
Okay, very good. Can you tell me, you were talking about the care that you received. Did you or your parents seek out the care, or did you talked about the system? So did you seek out care?
So it was my parents that actually referred me to therapy because they didn't really feel qualified at the time to really help me through this because this was a very novel concept to them. They didn't really understand it very well, and they didn't really feel like they were equipped with the knowledge they had at the time to help me through it.
Okay, so your
And
family.
and they didn't expect me to only be affirmed in this identity that I created for myself and to be pushed further into it. They didn't want me to go through the course of medically transitioning, actually.
Okay.
They just wanted to help me.
Family sought out care. The system did not seek you.
What do you mean by that?
Well, when you were testifying, it made it sound like it was a very aggressive system coming after people.
Yeah. I mean, they never pushed back on anything.
But
It was always, there was no questioning of the trauma that I'd experienced before. There was no questioning of why I felt so strongly about my sex and the discomfort around it.
yeah, but I'm talking about as far as like seeking care. I mean, you all took your family, initiated seeking help or seeking care.
Yeah.
Okay. And then I take it that you now work for Do No
Senator
Harm.
Holscher, I'm so sorry, but we're out of time, and we want to make sure we get our 15 minutes for our other conferees. Thank you, Chloe.
Thank you.
Thank you.
We'll begin the opponent testimony with Iridescent Riffle. And if I ever say anybody's name wrong, please correct me when you come to the microphone.
You got it correct. Thank you. Hi, my name is Iridescent Riffle. I am from Kansas. I am a co-chair of Equality Kansas Douglas County chapter. I use she, they pronouns, and I'm here today to speak in opposition to HB 2791. And I thank you for the opportunity to speak. I urge committee members to listen to medical professionals and queer and transgender resource organizations. I brought with me today a binder of studies regarding gender-affirming care, its efficacy, and supporting statements from every medical organization in the United States which are being missed, quoted today in our hearing. Today, I want to speak about the consequences that legislation like this has. When our identities are put up for debate, it strips us of our humanity. When I appeared before the legislature last year, I spoke of a teenager, Brianna Gay, who was stabbed to death by her peers who were emboldened by anti-trans legislation and misinformation regarding her identity. I hope such violence would have ended then. Shortly after Trans Day Remembrance last November, I lost a friend and fellow organizer who was shot and killed for being trans. In the last week of 2023, Amber Miner was shot and killed in Raytown, Missouri because of her trans identity. Then a little over 2 weeks ago, Next Benedict, a 16-year-old Two-Spirit Choctaw teenager, was beaten inside a bathroom at Owasso High School in Owasso, Oklahoma by several of their peers. Next succumbed to sustained injuries and tragically died. The violence that Next faced was perpetuated through anti-trans legislation in Oklahoma and nationwide. Shia Reichik, the account owner of Libs of TikTok, had been appointed to the Oklahoma Library Media Advisory Committee despite not being a resident of Oklahoma. Reichik's primary targets through her social media terrorism, and she has proudly called herself a stochastic terrorist on Twitter in the past. After news broke about Next's death, Reichik, now a government official, mocked Next on Twitter and later stated that transgenderism needs to be eradicated. Who else openly discussed the eradication of marginalized groups of people? Oklahoma State Superintendent Ryan Walters then made a post shortly after hearing of Next's death, focusing on ending wokeness. Next's ability to live safely and freely isn't woke, it's a basic human right and need. Should you vote in favor of HB 2791 or HB 2792 in the future, please know that their blood is on your hands. Thank you for your time and your attention. I'm happy to stand for questions at the appropriate time. Thank you.
Thank you. Next, we have Reverend Caroline Dean.
Madam Chair, members of the committee, thank you for this opportunity. My name is Reverend Caroline Dean. I'm testifying on behalf of Kansas Interfaith Action, a statewide multi-faith issue advocacy organization that represents hundreds of Christians and Jewish and Muslim communities throughout our state. I oppose HB 2791. If God is love, and that love is unconditional, that love, I say, is unconditional. Unimaginable. I was on a walk with a friend during the pandemic, and she shared that her child wanted to go by a new name, a gender-neutral name. She was worried that the kid's name would change a week later, a month later, a year later. People have this grief. It makes sense. And another friend said, if they change their name next week, you'll call them by that name. And the next month, and the next year, again and again and again. This is what it means to be a parent. To love someone, to set them free in the world. Parenting is this little human experiment of unconditional love. I stand today to ask you to share that grace and love with trans youth and their families as they desire to present themselves, their truest selves in the world. I'm a pastor of gender fluid, non-binary trans youth in our community, and it's my prayerful declaration that they're created in the image of God. The diversity of human sexuality reflect the glory and majesty of God in whose image we are all created. Transgender people, especially youth, are among the most discriminated against in our country today. There's a suicide attempt rate among transgender persons ranging from 32 to 50%, depending on location. Gender-affirming care is not undertaken lightly or frivolously. As my friends who are parents of trans kids know, they take this conversation seriously. No one would choose to take on an identity which puts them at great risk for violence. As a part of my testimony, I'm including a letter signed by 100 faith leaders throughout Kansas, our state, demanding that the legislature stop trying to pass these laws discriminating against trans people. Kansas Interfaith Action opposes this bill for 3 reasons. First, gender-affirming care is life-saving care. Imagine the government outlawing care that could help save your child's life. Every major medical association advocates against bills like these. Second, there's a big government solution in this bill that puts legislator opinions in the middle of these sacred relationships between parents and children, clients and their doctors, between people and their truest selves.
I'm sorry, I don't know if you heard it.
I
the
did.
alarm.
Thank
Okay.
you for your time today. I appreciate
Thank you.
this time.
Next, we have DC Heegert. I got it? Yep. All right.
Before I start, I was going to let you know, Chair, that One of our speakers is unavailable, Jay Moyer, and so if we could give Jay's time to Amanda McGhee. Thank you very much.
Very well.
Hi, my name is DC Heer. I'm a lawyer testifying on behalf of the ACLU of Kansas. We stand strongly opposed to HB 2791. This bill violates the constitutional rights of Kansas children, parents, therapists, doctors, and teachers, and poses an unprecedented threat to Kansas families by banning the only evidence-based healthcare options available for youth experiencing gender dysphoria. This bill would set a precedent that Kansas medical providers should not give you the nationally recommended best medical care available, but instead give you the medical care that politicians decide you should have access to. This bill forces the government into healthcare decisions that should be between a provider, the patient, and the patient's family. And it violates Kansas' constitutional right to personal autonomy, which the Kansas Supreme Court said, quote, includes the ability to control one's own body, to assert bodily integrity, and to exercise self-determination. This bill also takes away parents' rights to make decisions about their children's health care, a right that some in this room have vehemently defended in other contexts. And it threatens our healthcare providers for simply trying to do their jobs. Please listen to the Kansans here today. Kansans have shown you we do not want this bill because we know it will cause serious harm. And I do not mean that in an abstract sense. People will die. Families will suffer. The practice of medicine will be compromised not just for trans people, but for everyone in Kansas. I'm sharing this testimony as an ACLU lawyer, but also as a lifelong Kansan and a transgender person. The very care this bill attacks is the reason I'm alive and able to advocate for my fellow Kansans' rights. I love Kansas and I'm proud to call it my home. I know countless trans Kansans that feel the same way. But bills like these tell us our state does not love us back. Please don't make it harder for these young Kansans to live and feel welcome in our state. We urge you to vote no. Thank you.
Thank you. And next we have Kat Poland.
Good morning. My name is Kat Poland. I'm from Hutchinson, Kansas. I'm a third-generation, lifelong Kansan, and I'm a mom to 3 amazing children. One of my children has an uncommon and potentially life-threatening health condition. In fact, less than 1% of the American population suffers from this condition. He nearly died from complications of this condition in 2021. We almost lost our child. We found out there's treatment available, and we sought holistic treatment from many angles, but we found out there's one treatment available that could reduce our child's risk of dying by 40%. We felt that hope was not lost. Of course, no medical treatment is risk-free, but not acting also holds potentially dangerous implications. We did hours upon hours of research, consulted with a variety of medical professionals, those that knew our child well, and we spoke with other people with this condition. Ultimately, we decided, along with our child, and nobody forced us to do this or suggested this to us, we decided as loving, cautious caregivers to let our child pursue this treatment because the potential benefits outweighed the risks. The treatment worked. Our child's health began improving. He's been able to attend school regularly again, getting straight A's. Our child is happier and healthier than we have seen him in years. Now, why on earth would the government want to interfere with this type of treatment? Why would it suddenly become illegal for us to seek the medical care he needs? That's given us our child back. Because my son is transgender, because his condition is gender dysphoria, and because the treatment is gender-affirming care. Abusive. That's what some Kansas lawmakers are calling parents like me who have been fighting like hell to save our children's lives. HB 2791 is called the Forbidding Abusive Child Transitions Act, and that breaks my heart. I am not a perfect mother, but I am certainly not an abusive one. When I asked my son about this bill, he said, it would have been abusive not to help me. I've been asked if I'm worried if this treatment might prevent him from having children someday, but I'm worried about him being alive today and surviving until adulthood so he can have children, whether biological or adopted. My son was in such a state of despair after coming out as transgender, he swallowed a handful of pills and prayed he wouldn't wake up. Thank God he did. I don't like disclosing these things about my child to strangers, but you are not just any strangers. Okay, thank you.
Thank you. And the final opponent is Amanda McGhee.
I'm going to ask my daughter to come up and sit closer.
I'm sorry.
My daughter would like to come up and sit closer.
Of course. Okay, she changed her mind, Mom.
Now she's nervous. Okay.
Just one moment, and I'll let you know how much time you have.
Perfect. Thank you.
3 minutes and 52 seconds.
All right, I'm going to talk quick. Hi, my name is Amanda McGhee. We've been here, we've done this before a few times in the past, folks, so you know who I am. Today, you've heard from people who say that it is your responsibility to stand up for children. You've heard from people that have been brought across the nation to speak here today, but I'm here as a resident of Kansas. I'm here as a proud nurse, and I'm here as the only certified WPATH care provider in Kansas. As a nurse practitioner, I provide health care to nearly 2,000 LGBT plus community members at DimCare Healthcare in Wichita. I've laughed and I've cried with patients and their families. I think of them often. I think of their smiling faces and their happiness. And unfortunately, right now, when I close my eyes, what I think about is the scared faces. I think of the scared youth and their families and the other patients who are scared to lose their right to health care in Kansas. I am invested in my patients' physical and mental health, and I do want them to be well. I feel deeply protective of the young people whose families trust me with their medical care. Again, and I repeat, no youth are moving forward with gender-affirming care without the support and legal informed consent of all of their legal guardians. No youth are making these decisions on their own. No youth are being targeted by these organizations that support trans care. Nursing care is based on 4 key principles: autonomy, the right to self-determine a course of care for yourself; beneficence, the promotion of good, ensuring that a patient's good is always over the nurse's; justice, fairness, and impartiality regardless of age, gender, race, religion, socioeconomic status, sexuality; and non-maleficence. You may know that one, Dr. Stefan. Remember, it's do no harm. That's what we're doing here today. We're causing harm. We're causing harm to these kids who have to keep hearing over and over that they aren't worthy to be here. We keep hearing that the Kansas legislature doesn't care enough about these kids and their families to trust them to make decisions for their own medical care. I asked you to stop that. For the last 22 consecutive years, nurses have been considered the most ethical profession in a Gallup poll. In fact, since nursing was added to the poll in 1999, nurses have been ranked the most highly ethical profession every year, except 2021, where firefighters topped the list. With all due respect, there's a reason why nurses are considered the most ethical profession, not legislators, and frankly, not physicians. Nurse practitioners are shown to spend more time with patients. Research shows us that NPs provide high-quality care, and in 2022, the Kansas legislature gave us the ability to practice without collaboration with a physician due to y'all's trust in nurses. So in 2019, when I was asked to begin providing hormone replacement care to transgender individuals, I went through all the right care aspects so that I would become trained and certified by the governing body for transgender healthcare. WPATH is the internationally recognized for producing the highest level of standards for transgender medical care. So since 2019, I've received over 300 continuing education hours specific to transgender healthcare. I've completed a mentoring fellowship with a WPATH certified endocrinologist, and in 2023, I tested and became one of the only 188 WPATH certified providers in the United States across all specialties. So I am the only certified provider in Kansas. I am more than happy to speak with any legislators that want to really actually make safe standards of care, that we can move forward, we can build these committees, we can bring rules together, but totally outlawing care is just not the way to go.
Thank you. I'm so sorry your time is up. Thank you very much. Committee, again, we have about 4 minutes left for questions. Senator Petty.
Thank you, Madam Chair. Amanda, would you come back up? Amanda?
Yes.
Amanda, thanks for being here today. And
Thank you, Senator.
thanks for giving me that shout out for nurses. My daughter's one, so I totally agree with you.
We're very proud to be nurses.
You're here, and I noticed that you're from Kansas.
That's right.
And it appears that everyone that's an opponent is from Kansas.
You know, it worked out the same way last year whenever the sports bill came up. We had a whole list of opponents to the bill that were all from Kansas, and yet the committees decided to bring in people from other states to be proponents. And I, as a Kansan, find that deeply disrespectful. I think that we should be listening to Kansans.
Thank you. I do too. I totally agree. It seems that we have a Kansas parent, we have, and we have Kansas health providers. So I appreciate you being here.
Senator Petty, we only have time for one question for our committee. So next I will go to Senator Stephan.
Thank you. And I would love to ask you a question if you'd be so kind.
Speak with you.
During your testimony, you proclaimed that at least a portion of this group did not believe that kids are worthy, and that kids were being told they weren't worthy. Help me understand who's articulating to these minors that they aren't worthy, because I'll guarantee you it's certainly not me, and it's not anybody on the other side of the issue saying that. We're saying we're here because we care about the children. Are you telling kids they're not worthy? Do you talk about suicide to the kids?
Dr. Stephan, can I ask you, who told you when you woke up this morning that you were a male-gendered person?
I'm sorry, just answer the question, please.
Okay, well, my answer would be that this committee and the legislature over and over tells children that they are not valuable and not worthy to make their own healthcare decisions and to say who they are and to be believed.
And committee, we have one more question, Senator Holscher.
Thank you. My question is for you. It's my understanding restrictions on gender-affirming care are opposed by credible medical bodies and organizations across the country. Additionally, I did some Googling as I was sitting here and found that some of the testimony provided by the proponents has been debunked. Can you speak to that?
Oh, a vast majority of the testimony that was provided has been debunked. As a matter of fact, the American Medical Association, it says in my testimony, the American Pediatric Association, the American Endocrinology Association, among many others, actually says that trans care and trans care for youth is medically appropriate and is evidence-based care. So I feel very confident in supporting all of the major medical associations as well as WPATH when I stand here and say that care for trans youth is not only life-saving, medically necessary, and it is evidence-based.
Senator Thompson, we have about 30 seconds.
Yeah, very quickly, same conferee. Are you aware of a group of 2,308 signatures that discredits, it gives a very long list of reasons that WPATH standards of care is fatally undermined by ethical violations and errors?
I'm not aware of who signed that. Could you tell me who signed that?
Well, there's about 2,300 of them, and it's a variety of psychiatrists, pediatricians. I'm looking at the entire list. I could go down the list, it was 2,300 people.
I'd love the opportunity to collect a list of all the people who support the care. So while I respect that there are people who have differing opinions, because there was a collection of 2,300 that signed on to this, that doesn't mean that there aren't another 2,300 or more that firmly support WPATH. And as a matter of fact,
I'm sorry to have to cut you off.
You should.
Our time is off. The informational briefing on Senate Bill 2791 has been concluded. Committee, the meeting is adjourned.